We all know the drill. You wake up in the morning with a runny nose, itchy eyes, and a sore throat. But since the pandemic, you wonder, is it COVID-19 or allergies? We sit down with family practice Dr. Esmeralda Arreola of Community Health Partners, who explains the difference between COVID-19 and seasonal allergies and how to feel better when those allergies hit.
Seasonal allergies are symptoms that afflict many people in our area that are in response to what's in the air in our environment.
If you've experienced seasonal allergies, you are all too familiar with the havoc they bring.
The common allergens are pollen, grasses, weeds, even mold. The biggest time of the year for us here in the valley is definitely the early spring. Although some people can experience symptoms even in the fall, there are different things that are blooming and springing in the fall. Because they're seasonal, they come during certain seasons of the year, and they are symptoms of itchy eyes, runny nose, watery eyes, even sore throats, headaches, lots of different things.
You might even be cautious or concerned when allergy symptoms set in because of the recent coronavirus pandemic. But Dr. Esmeralda Arreola with Community Health Partners says there are definite differences you can identify between common allergies and an infection like COVID-19.
In general, infections like COVID is an infection. They tend to cause fever and sudden onset of symptoms, body aches. And those are the most distinctive symptoms that are different for allergies. Allergies are more gradual, slow, progressive symptoms, and infections tend to be more sudden in onset.
However, even though allergies might be more common, you should still treat symptoms early.
As soon as you start feeling the symptoms and you recognize them as allergy symptoms, that you start taking something. Allergies can be complicated and become complicated by sinus infections. So if you were to let your symptoms of allergies go longer than they should, you could end up having a sinus infection, even an ear infection. Some of the things that we recommend are over-the-counter options. There's lots of them. Your antihistamines, your nasal sprays, those are all great over-the-counter options that are readily available to you.
When temperatures cool in the valley, it's hard to stay indoors and away from allergens, but Dr. Arreola says there are preventable measures you and your family can take to stay healthy and still enjoy the outdoors.
I think just keeping your indoor spaces clear of what's outside, so unfortunately keeping windows closed. Other things that you can do yourself is change out of your clothing when you come inside from being outside, and washing your nasal passages, washing your hair as soon as you come inside from being outside.